Dr. Charlene DeHaven, Clinical Director for Is Clinical, Dr. Tal Hughes, founder of Vital Medical Aesthetics, and for the first time on stage with Is Clinical, Karli Plunkett, aesthetic injector and owner of Nectar Aesthetics.
Matt said that Dr. DeHaven's talking about retinol.
I'm not.
Next.
I mean, later I am.
Later. Matt, off schedule. He's already on Paris time, what can I say? So we wanted to take some time to share from different point of views, different experiences. How do we approach our patients and our clients evaluating the full face? And I'm sure all of you guys have your tips and tricks on how to address this, but the truth is it's a long journey with our patients and our clients for them to understand how every single thing is connected to the next, right? So Dr. Hughes, you have had medical spas for over 15 years, so you've really seen the change of the non-surgical aesthetic industry and how it's evolved. When people just come in, all they say is, I want my lips filled, right? And that was the beginning and the end, to now where it's a little bit, it's changed a bit. So speak a little bit to your experience of how the patient or the client has changed through the industry.
They're smarter. You guys see this, don't you? These patients come in now and they're paying attention to what's out there on social media, what they're seeing that they like and don't. So we've gone from this very singular, narrow focus where they would come in and it was that one brown spot or this one wrinkle or I just want my lips done, as you were saying. And now they're saying, I want to look more youthful, I want to look more refreshed. And we know as clinicians, we can't do this with just one modality. We can't be just an injector and all we do is have our neurotoxin and our fillers, right? That's how they become blowfish. We have to also treat them from the top down instead of just deep to more superficial and be able to treat them and give them that full face plan.
So Karli, you've pulled it together, you call it, Dr. Humes, the full face plan. Karli, you call it something a little bit different. So talk a little bit about your theory and your practice, starting as a medical esthetician, then becoming a nurse injector, and just kind of that journey of your career and how you've been able to change your clients.
Yes, so I actually started out, as you mentioned, as a medical esthetician for almost a decade before I became actually PA. I became a doctoral PA about 7 years ago that I've been injecting now. So even in that time, I did notice this shift where patients originally were coming in for this one line, this one dark spot, hollow under eye, this one thing, and it kind of became my responsibility to guide them, to show them a more full picture. And one of the key aspects that I talk about with my patients is I want to get to the root of the problem, because if we don't start at the root of the problem, then I can't get you to this beautiful final destination. So starting at more like cellular level.
Well, and that's what Is Clinical is all about. We had this interesting conversation, we were just in this a meeting this last week with Dr. DeHaven, with Brian Alec and other members of the team, where we talked about, we actually don't like the term anti-aging, because the truth is we're all aging, and it's not a bad thing, is it? I mean, you could only be so lucky to age, because that means you're still alive, right? But yet, we want to look our best, we want to feel our best. And the way that we do that here at Is Clinical is by improving cellular health and integrity. So, Dr. DeHaven, as Brian always says, healthy skin is beautiful skin. And I think sometimes people think, oh, I need a Botox, or I need a filler, I need this. But the truth is it really starts at the skin. Talk about improving the cellular level and how that really enhances a patient's outcome holistically.
If one just, and you all see this in your practices, if one approaches the problem of let's say the aging face and the aging body and everything, with I just want it to look better and that's all I care about, the biggest part of what's going on and driving the process will be missed. And that is what's going on at the cellular level. That we deal with it as clinical, that our two practitioners on the stage today know intimately about, because they are very concerned and deal about that and deal with that in their practices. You cannot improve, let's say, the texture of the skin, the glow, the luminosity, all of those things that we associate with beauty are simply health. And you can take anybody, you don't even have to have the best bone structure. And as one is getting older, if you take that person and you improve their skin health, they become a lot more beautiful. It's just It's a necessary, the beauty is a necessary byproduct of improving the health. And then if you add the filler and all the other modalities also, you've got like this full face thing that, you've dealt with everything. And that's where you want to get to, is the complete picture.
Well, and you don't know that for yourself. I've been in this industry for almost 20 years, and I said to Dr. Humes, I said, okay, I've noticed that like my cheekbones are not as full as they once were. I may be thinking about doing a little something. And you know what she said to me? She goes, no, we need to fix your chin. I'm like, what's wrong with my chin? I wasn't even thinking about my chin. But you know what I mean? You don't really understand what it is that you need to do, as because you just thought you've lost some bone volume here in your chin. And like, I felt great about my chin, and now I don't. I really appreciated it. I'm like, oh, I wouldn't know that. And I think that that's really important. So Dr. Humes, how do you enter into the consultation process with your clients when they come in saying, I want lip filler? And then how do you take that and then turn it into this full face plan?
For me, what I'm doing is I ask them first what it is they see. If they've come in and say, I just want my lips, I'm like, okay, but if we do your lips, let's talk a little bit about how that's going to look on your face, right? Because right now, it's not popular to have really big lips compared to the rest of our face like it was 5-10 years ago. And if they're not doing that, I say, what's it that bothers you? And then from there, I'll also point out what I see. Or as Molly was saying, right, she's like, oh, I feel like I've lost volume here. I was like, yes, but if you do something here and you don't balance with your chin, I'm like, I notice this more. And I think it's our responsibility to let our patients know what it is we're seeing. Otherwise, we're doing them a disservice, because what they see in the mirror, even ourselves as clinicians, what we see in the mirror on ourselves isn't always what the world sees from us.
So Karli, if you want to go through this diagram that's behind us and how you approach this with your clientele.
Yes, I do. I actually assess my patient before I walk in the room. I look at the photos that my MAs have brought me, my wonderful MAs that I couldn't live without. And I do that because I tend to genuinely like people when I meet them. And once I walk in the room, I get to know them and love them. I don't see these tiny imperfections so much anymore. So I actually like to assess before I walk in the room. That's just my preference. And before I walk in the room, looking at the photos, I'm evaluating kind of their, call it facial thirds and facial fits. I'm looking at their upper, their mid, and their lower face lengths and assessing to see if they're actually in proportion and balance. Then I look at the facial fits, which is kind of the width of the nose, to the width of the cheek, to the width of the eye, jawline, temple, just kind of evaluating, does that all make sense? And I kind of have this idea in my mind of where I want to go before I even walk in. And then I start to talk about skin. So that's usually one of the first things I go to when I walk in, is I talk about skin. And I'm asking them questions to find out, where are we with barrier dysfunction? Do they have this serious inflammation that I need to get control of first? Because there is an inflammation cascade that occurs in the skin. And if you can't get control of that inflammation cascade, it doesn't matter what lasers you use or what you do to their skin. They're not going to respond in the way that you want their skin to respond. And in fact, you're more likely to cause damage like post-inflammatory hyperpigmentation, scarring, things like that. So I start with my little flow sheet that I created. So I assess for the barrier dysfunction. If they have barrier dysfunction, that's the number one thing I have to fix. This is the other thing I love about Is Clinical, is I say they have a vitamin C for everything. So they have a vitamin C if you have barrier dysfunction, it's called ProHeal. And they have a vitamin C if you don't have barrier dysfunction, but you do have DNA damage, because that's my next question, and that's Gen XE. And then once you fix the DNA damage, then you can progress on to actually working on their concerns, actually working hardcore on that wrinkle and on that age spot. And that's where I prep them with Super Serum Advanced. So those are kind of my favorite. That's like where I find those vitamin C's really fit in really well. And then for acne, my favorite, hands down, if it's oily acne, is Active. And if it's more of a dry acne, I love the new retinol. The new retinol, I'm a huge fan of. I use it every single night from when it came out, and a huge fan, never had any issues. And I love that it doesn't inflame the skin the same way like a retinoic acid does, because there are multiple cofactor, processes that need to happen before that retinol is actually usable in the body. So it gives it like a time release system, and I love that about it.
How many of you noticed a huge shift with the consumer after the pandemic, where the idea of self-care became much more prevalent? Yes. Didn't we all? And then also, don't you understand, haven't you seen, I've seen this, where the patient, the client, they actually understand that it's not a one-trick fix anymore. They've been a little bit more receptive to that, haven't they? Yeah, they understand that it's a journey. It's just like if you want to be in shape or you want to be fit, you can't just go to the gym for one spin class and it's done, right? They really understand now that it is a journey and it's a lifestyle, the way that you take care of your physical appearance and also your internal, your internal. So Karli talks about inflammation, which of course, Dr. DeHaven, you've been speaking about for years. Inflammation is one of the biggest causes of skin aging. And Karli brings up a great point. If we aren't able to reduce the inflammation and we're doing a laser, we're doing a chemical peel, we're actually gonna cause more damage. Speak to that a bit.
Most people, well, certainly the people that come in to see you, and I think a lot of the people here understand how important inflammation is, and that it drives every negative skin process and condition that we've got going on, and it also drives aging, because as we get older, our, let's say, baseline level of inflammation tends to rise, and we have a higher and higher baseline. So that will in itself drive the aging process in addition to all the other stuff that's going on. It's very important to address that. And that's why every clinical product has anti-inflammatory potential, because they all contain antioxidants. Most of them are botanically based, most or all of them are botanically based. Botanicals, plants grew up in the same radical rich environment here on planet Earth that we did. They deal with the same stresses from the environment that we do. And to use them in his clinical products is a huge advantage. We're ahead right from the start. There are a number of things we do in our practices that will, if left alone, up the inflammatory process. And those are things like aggressive chemical peels. Ultrasounds now have proven that when you inject filler, we didn't used to know that, but now we do know that there's a pro-inflammatory process that goes on. You can't see it in most people, but it goes on. That's why no matter what you're doing in the practice, one must also address the inflammatory process. One must damp it down from the procedures that and the techniques that we're using. One must damp it down to control the aging process and lessen the velocity of aging for everybody. It's essential that we deal with anti-inflammatory techniques, let's say.
So Dr. Humes, how do you bring a patient through the journey of making sure that they understand it's not just like a one-stop shop, and also how do you get them, let's say they come in, they think that they're gonna get a facial once or twice and then that's gonna be it. Like, how do you handle that as far as your bedside manner? And are you as bossy with your patients as you are with me?
You know, I'm
kind of
bossy in a different way.
That's okay, bossy's kind of good sometimes.
Yeah, bossy in the sense of, it's all about education. One of the things I'm never doing is saying you have to do this, but it's educating them on why. And it's not every minute detail, but it's picking and letting them understand that, you know, just because they see the hollows under their eyes, let's say, and this is a big one I find. People come in like, I want under eye filler, and they just want that. But really we need to start by that scaffolding. We need to build up their cheeks so that it moves the shadows. We need to talk with them about all of the uneven texture and tone they have on their skin. So what I'll do is with that mirror, I will say to them, I see what you're seeing. Now let's talk a little bit about how we can treat this and what else is going on. And I really start with the education piece, because when I'm educating them, then I don't have to direct them as much as they start to see it and understand.
Karli, if you want to go through this diagram that you created for us and how you map your treatment by concerns out.
I would love to. You know, there's one way that my practice has greatly evolved over the last couple of years. You know, I did start to notice more and more that as patients sit in our chair, they are incredibly vulnerable. So, you know, you remove their makeup, and in my practice, they're sitting in bright light across from someone that they're just meeting, and they're like, are you about to tear me apart? Mm-hmm. Are you about to tell me everything that's wrong with my face and why it's wrong and how you're gonna fix me? So one of the first things that I do is I actually hand them the mirror, and they're always a little thrown by this, but it works out well, and I ask them what they like about their face. What do you like, you know? Number one, it gives me insight into their psyche. Do they have a little body dysmorphia disorder? You know, are they drop dead gorgeous and they don't like anything about their face? So it gives me insight into that. Number two, one of the biggest concerns that patients have with coming to see aesthetic providers is they don't want to look different. They still want to look like themselves, right? So I find what they love about their face, I consider that to be the anchor of their face, and I explain, I love that. I think you have beautiful eyes too, and I don't want to change them. But I want to make sure that everything else matches that. So if you have these incredible, exceptional cheeks, and I say people spend thousands of dollars to get your cheekbone structure, they're amazing, but I need to make sure everything else matches. So one of the things I like to do is sprinkle in some humor. We say chin, I'm like the chin queen of Orlando, and we say chin, and they're like, oh my god, and I'm like, no, I promise I'm not gonna make you look like Gaston or Jay Leno, it's okay, calm down, you know, and I kind of show them some photos. So I find that using this Venn diagram is one of the best ways to take what they're looking for, what their goals are, and what my goals are. Because I already had an idea of what I wanted to do with this patient before I even walked in the room. So I can find out, you know, now tell me, what do you want to address today? And if like, I really want to go after this wrinkle, and I'm like, man, I can see major skin tone issues, I really want to go after this skin tone, then I can take what I want to do and what they want to do and combine it and get magic. And that's where this little Venn diagram came in that I created. So if I really wanted to go after pigment, let's say, and they really wanted to go after skin texture, then I would look at doing something like a Cool Peel or a Moxie or a BBL. It just kind of depends on, you know, I'm gonna prioritize their thing a little bit higher than mine. So those little extra arrows you see there are, you know, like BBL, for instance, does pigment a little bit better than texture. So you can kind of see which way they lean. And that's where I really bring in this component. And then the way I explain it to them is I draw up this whole global consultation and I say, look, I'm gonna give you my recommendations as if you're my best friend, as if you're my sister, and I'm gonna give them to you as if money's no object, because I don't know what's in your pocketbook. I don't need to know, that's not my business. My business is to tell you what I think you need as if you're my best friend and you're my sister, right? I call that girlfriending them, right? We're on the same team. We're on the same team, we have the same end goals, and let's figure out how we can get you there. And I write up a full global consultation so there's transparency, there's clarity, and there's lack of miscommunication because it's all written down. You know, yes, I told you PRF under eye would be perfect for you because it's gonna thicken up your dermis, et cetera, but I did say you would need 2-3 treatments. I didn't say it'd be a one and done, and you can see because on your calendar here, I wrote that you were gonna do it 3 months in a row. So it also helps with that it enables them to budget. You know, so they can see how they can fiscally fit it in. And that's why when I hand it to them, I say, look, this is just a treatment plan. It could take you a year, it can take you 6 months, it can take you 3 months. Do you want to walk, run, or sprint? You know, what do you have coming up? Do you have a wedding you want to look great for? Or do you want to budget this out so it doesn't stress you out? You're building a house, whatever. You know, you just have that conversation, that back and forth with them, and then they're committed. They feel like you're on a team, and you're not there to just sell them some stuff.
Mm-hmm.
Dr. Humes, you always say you sell outcomes, not treatments. Speak a little bit to that.
Yeah, when our patients come in, when you're listening to them, right? Like I said, I start off every consultation asking them about them. And what they're telling us oftentimes is, I want to look more youthful. I want my skin to look more healthy. I want to feel better, right? Oftentimes it's that the way we express ourselves, like, you know, we were saying, not everyone is absolutely gorgeous, but that once they're healthy, they do have that glow and they do look beautiful. So I always say that what I'm trying to do is meet their ultimate goal. And I can't do that with just one thing, which is where combination therapy comes in. And so I can't just treat that one thing and get them where they want to be, even if that's only what they see. And so for me, it's all about what is their ultimate goal, which is usually, like I said, either having clearer skin, looking more youthful, feeling like themselves, like they did, you know, they're not going to look exactly like they did 20 years ago, but feeling more like they're there. And then from there, getting them by that combination therapy and giving them a plan, as Karli was saying.
I remember I was running a practice actually for Dr. Humes, and a woman walked in. We were in this really nice upscale shopping area, and a woman walked in who happened to live just up the street. And she came in and she had just had, now this is in the mid-2000s, guys. So you'll remember, those of you who were in the industry at this point, this look. She had this, she had just had a facelift. And she like, you know, it's like what you look like when you go down the roller coaster and they take the photo of you, you know? That's what she looked like. And she thought she looked great. She thought like, she was like so fabulous. So she comes in, she goes, what do you guys do here? Do you do surgery or something? I said, no, it's all non-surgical aesthetics, injectables, we do facials, skincare, and she goes, that stuff doesn't work. And I'm like, okay, girl, you know. And let me tell you though, so she was totally taught, okay, she wasn't, I would say she was probably 60 years old. She was complete, she had no laxity on her neck, she was pulled back,